Good day. The title of my presentation is Ramadan Experience, Maximizing Benefits, Minimizing Risk. It is a structured patient education program. My team members. Together, we form the endocrine unit in Hospital Al Sultan Abdullah, UITM Pujalam. Our team has come together to formulate and to organize this program. Incidence of type 2 diabetes mellitus in Malaysia is increasing exponentially, with an estimation of 3.9 million adults diagnosed according to the recent Malaysia National Health and Morbidity Survey. This is contributed largely by the Malay race, with a prevalence of 59%, followed by the other races, translating into a significant portion of people with diabetes who will be fasting in the month of Ramadan in Malaysia. Indeed, Malaysia lies in the geographical region with the highest Muslim population in the world. And in an international survey assessing people with type 2 diabetes, it was seen that more than 95% of people in Malaysia fast in the month of Ramadan regardless of their diabetic control, contributing to the largest number when compared to other participating countries. Ramadan fasting may have an impact on the metabolic profile as reflection from lifestyle changes during continuous fasting, including caloric restrictions, alteration in physical activities, and sleeping patterns. Those fasting in Ramadan generally consume two main meals per day, namely the pre-dawn meal of suhoor and the sunset or breaking of fast meal. But many, depending on the region, may also have snacks during permitted hours, and this can inevitably disturb glycemic balance, leading to erratic diabetic control. Comprehensive advice concerning dietary adjustment and medication titration during fasting is essential on approaching the holy month. Understanding nutritional habits and the impact of different dietary patterns aids greatly in managing glycemia during fasting. In a two-arm parallel study looking at the comparison between a structured nutrition therapy for Ramadan with standard care in type 2 diabetes patients in Malaysia, it was shown that the structured nutrition regime for Ramadan had improvements in both clinical outcomes and quality of life. Subsequently, a narrative review looking at 14 studies assessing the impact of nutrition on diabetes control in Ramadan. There was evidence found for the effectiveness of Ramadan-focused nutrition therapy, with some key features identified. These findings were then incorporated into international guidelines, where the International Diabetes Federation Diabetes in Ramadan guideline has incorporated specific meal plan for Malaysian patients. Fasting in Ramadan is beneficial. However, in those with diabetes, it is challenging, requiring sufficient and comprehensive medical advice. This was shown elegantly in this study done looking at admissions in the hospitals around Malaysia during the month of Ramadan. It was seen that there was an alarmingly high rate of admission due to complications of diabetes, mainly due to hyperglycemia or high blood sugar. And what was more worrying, more than half of the population who were admitted did not recall receiving advice regarding fasting in the month of Ramadan. To address this issue, a special program was fashioned for patients attending the endocrine clinics in University Technology Mara Medical Center. This program aimed to fulfill a few objectives, namely to facilitate knowledge attainment and improve dissemination of information, to mitigate the risk of diabetic complications in Ramadan, and to pave the way to fast safely. This Diabetes in Ramadan patient education program was specifically designed and conducted for the Muslim population with diabetes attending the endocrine clinics in UITM and was held for a whole month leading to the month of Ramadan. Adult patients with type 2 diabetes mellitus who are planning and eligible to fast were recruited and enrolled in the program. They were enrolled from both the endocrine clinic in UITM Sungai Buloh and in UITM Puncak Alam. Referencing the Malaysian Type 2 Diabetes Mellitus Clinical Practice Guidelines and the International Diabetes Federation Diabetes in Ramadan Guideline, important information on managing the challenges diabetes patients face in the fasting month was assembled and translated into an interactive program. Risk stratification for patients fasting in Ramadan was taken from the IDF guideline, which itemized the specific factors influencing diabetes control with further categorization into mild, moderate, and high risk for fasting in people with diabetes. This program had emphasis on dietary modification, focusing on the timing of diet and specific meal plans. Themed the Ramadan experience, maximizing benefits, minimizing risks. This comprehensive patient education program was conducted and organized into two main parts. The program provided comprehensive education on fasting in Ramadan for people with diabetes, organized into small pocket group educational lectures and personalized risk stratification with specialized medical guidance. Patients attending the UITM diabetes and endocrine clinics were divided into small pocket groups, stratified depending on their appointment time. The members of the group were educated on the handling and management of diabetes during fasting through a series of lectures delivered by medical professionals. This was enabled by using audio and video presentation modules to facilitate better understanding among patients and caregivers, followed by a Q&A question and answer session. The lectures addressed issues largely encountered by people with diabetes fasting in the month of Ramadan, focusing mainly on dietary aspects, encompassing dietary modification, optimal nutritional adjustment during iftar, sahur, and timing of snacks, with an overview of calorie and carbohydrate adjustment to medications. In addition, the lectures also emphasized on monitoring blood sugar levels during fasting and medication adjustments. The second part of the program involved a personalized risk stratification with specialized medical guidance. Each patient had then an individualized consultation with an appointed specialist from the endocrine team, where they had a risk calculation of fasting in Ramadan and further explanation on managing diabetes during the fasting month. The risk of fasting was calculated based on the IDF Ramadan practical guidelines, categorized into high, moderate, and low risk of fasting in Ramadan. The participants were taught the optimal timing for monitoring the blood sugar levels with contingency strategies. They were also acquainted with situations where they had to break their fast and the reasons for doing so. The patients were then given detailed information on management of their medications during fasting, ranging from timing to titration. The medical guidance was inclusive of advice on lifestyle modifications. The participants received customized information on dietary recommendations and judicious physical activity endorsed during the month of Ramadan. This whole education process was facilitated by a booklet which was designed and produced specifically for this program. This compendium was fashioned mainly in the Malay language to enable better understanding in the local population. This guide detailed essential knowledge on fasting in Ramadan for people with diabetes, starting off with describing the challenges encountered by people with diabetes fasting in Ramadan and the possible complications, going on to detail approaches and approved steps in management. This guide then divided into a few categories, including population at high risk for continuous fasting, complications and symptoms with medication titration, both oral medication and insulin. This reference also included timing of blood sugar monitoring and dietary tips. This program attracted more than 120 participants and was well received with positive feedback from the attendees. The main benefits derived from this program was seen through better understanding of glycemic monitoring and dietary modification, leading to improved fasting experience. As evidenced by this program, a multifaceted diabetes in Ramadan educational activity is essential in increasing awareness and improving diabetes control during fasting. This program utilized a cohesive structure of integrated diabetes management with a team consisting of physicians, endocrinologists, diabetic educators, and dietitians. To provide a greater impact, a recommendation is crucial for a similar comprehensive program that can be translated to a larger group of participants with multi-center engagement involving primary, secondary, and tertiary medical centers. In conclusion, a practical tool that is simplified for general use is essential in empowering people with diabetes to handle their condition better and to facilitate safe fasting in the month of Ramadan. This guide was designed to fulfill this requirement and aspires to be beneficial in clinical practice and additionally function as a valuable instrument for personal and public use. With that, thank you.